Hello and welcome to the Joint Commission Resources Quality and Safety Network Accreditation Update. I'm your host, Gail Garbarino. Healthcare professionals typically take great pride in providing the best possible care to their patients. Unfortunately, too often, this diligence and attentiveness falters when the patient is handed off or transitioned to another healthcare provider for continuing care. Potential for patient harm is introduced when the receiver gets information that is inaccurate, incomplete, not timely, misinterpreted, or otherwise not what is needed. When handoff communication fails, many factors are involved, such as healthcare provider training and expectations, language barriers, cultural or ethnic considerations, and/or inadequate, incomplete, or non-existent documentation, to name just a few. While it sounds simple, a high-quality handoff is complex. Failed handoffs are a long-standing, common problem in healthcare, so much so that in 2006, the Joint Commission established a national patient safety goal that addressed the handoff communication, and in 2010, the requirement became a standard. Provision of Care Standard PC 020201, Element of Performance 2, requires that the organization's process for handoff communication provides for the opportunity for discussion between the giver and receiver of the patient information. Nevertheless, gaps in communication during handoff processes continue to exist, thereby increasing patient safety risk. The problem is compounded by the high frequency of handoffs in healthcare, especially in hospitals. It's estimated that a typical teaching hospital may experience more than 4,000 handoffs every day. However, sometimes handoffs are conducted too casually when they should be structured and focused to ensure continuity of care. Recognizing that each healthcare setting has its own issues and challenges related to handoffs, the Joint Commission emphasizes the importance of healthcare organizations using a process that identifies causes for handoff communication failures and then identifies, implements, and validates solutions that improve performance. The following are actions suggested by the Joint Commission to help improve handoff communications. First, demonstrate leadership's commitment to successful handoffs and other aspects of a safety culture. Standardize critical content to be communicated by the sender during a handoff, both verbally, preferably face-to-face, and in written form. Make sure to cover everything needed to safely care for the patient in a timely fashion. Standardize tools and methods such as forms, templates, checklists, protocols, mnemonics, etc. to communicate to receivers. Conduct face-to-face handoff communication and sign-outs between senders and receivers in locations free from interruptions, and include multidisciplinary team members and the patient and family as appropriate. Standardize training on how to conduct a successful handoff from both the standpoint of the sender and receiver. Use electronic health record capabilities and other technologies, such as apps, patient portals, and telehealth, to enhance handoffs between senders and receivers. Monitor the success of interventions to improve handoff communication and use the lessons to drive improvement. And sustain and spread best practices in handoffs and make high-quality handoffs a cultural priority. The Joint Commission's Targeted Solutions tool for handoff communications, to which Joint Commission accredited organizations already have access, can assist in managing this quality improvement process. For more information on this and other Sentinel event alerts, please visit the Joint Commission website at jointcommission.org/Sentinel_event. Now stay tuned for today's JCR QSN program.